To Louisiana now, where the state's largest hospital, Our Lady of the Lake Hospital in Baton Rouge, just admitted a record 32 new COVID patients in just the past 24 hours. According to a hospital spokesperson, 175 people currently hospitalized there with the virus, 61 of them in the ICU. Across the street at Children's Hospital, 8 children hospitalized with COVID-19, including a baby just 3 weeks old. Joining me now, Dr. Christopher Thomas. He's a critical care physician at the hospital. Doctor, thanks so much for taking the time this morning. You have said that at your hospital, you're becoming, in your words, victims of the unvaccinated here. And we've heard this more and more, that this is a pandemic right now of the willfully unvaccinated, right? Because there is a widely available and efficacious, more than one vaccine. Are you finding that as the number of infections go up, that people are changing their minds, that those who were hesitant are now getting the shot?
Good morning. I believe we're seeing some hope as it relates to people both texting their doctors and calling them to say, what do you think? Yeah. Delta is disastrous. As you said, we're admitting one patient every 45 minutes. Wow. The biggest challenge here is we've learned from Delta. One of the lessons we've learned is if you are online and you see a website or a blog, and that website or blog makes some therapeutic claim that's equivalent to the vaccination, let me be honest this morning. The providers of that blog will not come to the hospital. They will not come hold your hand when you're able to not breathe. We have 15 to 20 people. They will not come and say you were the victim of misinformation. And so as a result, what we have is a group of people who have misinformation that they think is equivalent to vaccination. That's not the case. So we're actually getting better, but it's because we're aggressively going against this misinformation campaign and trying to help our patients again.
Yeah, it's a national problem, really international, because a lot of outside players coming in kind of helping to stoke this. What is it doing to the staff of your hospital? Because, you know, the numbers we're talking about now, these surges seem very similar to what we thought was behind us, you know, the worst of the pandemic a number of months ago.
Yeah, our staff is tired, but they're compassionate and they're committed. We were able to get relief from a disaster management assistant team this week into our hospital, and so that's energized some of our team members that they will get a break. We've also become much more aggressive as a hospital system in trying to get out to our patients and saying, please call us, please talk to us. We want to protect you. We want to get you a vaccine. And we've seen that work in some instances. But I will be very honest, our team is tired. And there's no other way to say that. They're also looking at a season here where for us in Louisiana, there will be times where they're not going to be at the dinner table again. And that's okay because we're committed to it, but it's a challenge for them.
I hear you. How concerned should we be? Because when you see these spikes, you know, this is the summertime. You know, typically the best conditions for a virus are wintertime, et cetera. How concerned should we be that we're seeing winter-like numbers in the midst of the summer? And what does that mean going forward?
Here's how concerned you should be. We have 175 patients in our hospital. If you're a hospital administrator in the United States, that is a frightening number. It would overwhelm over 25% of the hospitals in this country. As a result, it means that we're impacting other diseases. Stroke, sepsis, heart attack require time to diagnosis and a bed available and a place to put them. We don't have a place to put them, and we are saying no for the first times in our careers. We don't like it, but when we get calls from colleagues who are just desperate for help, we're having to say we don't have a place for you. We need to recognize that if your community is not here in Louisiana and you're less than 40%, Delta is coming. Get out to your community, make that number higher, because you will not be able to handle this number of patients. Winter, summer, spring, fall, there are only so many beds.
Listen, we appreciate your candor here. It's important to hear that message. Before we go, are you seeing more young victims of this in your hospital? And are you concerned that the Delta variant is fundamentally more of a threat to young people?
Delta is different. 61 ICU patients, 60 unvaccinated. Average age this morning, 48. We had almost no children in our children's hospital throughout the entire first, second, and third surge here in Louisiana. We now have children in our pediatric hospital. Wow. Delta is not the same. You cannot avoid it. You're going to get it. How are you going to think about receiving the virus and what's your protection going to be? There's only one evidence-based strategy right now that's effective. It's a vaccination. Please think about it. Please call your doctor. Please go get one.